Hey everyone, I'm your host. Today, we're tackling a topic that can feel a little overwhelming for the NCLEX, Integumentary Pharmacology. That's just a fancy way of saying skin medications. When you're studying, you need quick, reliable ways to recall information under pressure. That's why we're going to use a mnemonic-first strategy. We'll start with a simple phrase that unlocks all the major drug groups you need to know for your exam. This isn't about memorizing every single detail, it's about building a mental framework that makes the details stick. Our goal is to get you recalling these drugs fast, so you can answer those questions correctly and move on with confidence. Our main mnemonic for today is Papa fixes red blemishes. This simple phrase is your key to organizing the chaos. Each part represents a major drug category we will cover. P. Permethrin, A. Antivirals, P. Azoles, antifungals, A. Antibacterials, red blemishes, retinoids, and benzoyl peroxide. Let's get started. First up in Papa is P for permethrin. This is your antiparasitic champion. Permethrin puts a permanent end to parasites. When you see scabies, think permethrin. When you see lice, think permethrin. These tiny critters cause itching and discomfort. It attacks the mites' nervous system, causing paralysis and death. Generally safe for humans when used correctly. Permethrin 5% cream for scabies. Permethrin 1% lotion for lice. Scabies, apply from neck down to soles. Leave on 8-14 hours, usually overnight, then wash off. Lice, apply to hair and scalp. Leave about 10 minutes, then rinse. Side effects: itching, stinging, redness. True allergic reaction is rare. Nursing checks: assess the skin before and after treatment. Ask about allergies. Treat household members and close contacts too. For scabies, cover the entire body, not just itchy spots. For lice, use a night comb to remove eggs after treatment. Environmental cleanup: wash bedding, towels, and clothing in hot water and dry on high heat. Seal non-washables in a plastic bag for 2 weeks. Next in Papa is for antivirals. For skin, we are mostly fighting herpes simplex virus, cold sores, and genital herpes. Remember, acyclovir attacks active viruses. The vir ending is your antiviral clue. These meds don't cure the virus, it stays for life, but they manage outbreaks, help sores, sores heal fundian sores heal faster, and reduce frequency, pain, and itching. Common topicals: acyclovir and penciclovir. For severe or frequent outbreaks, oral acyclovir or valacyclovir. Mechanism: inhibits viral DNA replication, so the virus can copy itself. Most effective when started at the first tingle. Side effects are minimal and local: mild burning, stinging, or pain. Nursing checks: document lesion appearance and ask when symptoms started. Teach: apply with a cotton swab or gloved finger, and wash hands before and after. Avoid kissing and sharing utensils, cups, or towels. For genital herpes, abstain while lesions are present. NCLEX tip: for simple cold sores, think topical first. The second P stands for antifungals. Azoles are for fungus control. Look for azole, clotrimazole, miconazole, ketoconazole. Indications: tinea pedis, athlete's foot, tinea corporis, ringworm, and cutaneous candidiasis. These thrive in warm, moist areas. Most are over-the-counter creams, powders, or sprays. Simple athlete's foot can often be treated with clotrimazole cream. Mechanism: azoles disrupt ergosterol synthesis, weakening the fungal membrane so the cell leaks and dies. That's how rashes, itching, and scaling clear up. Side effects are usually mild and local: slight burning, redness, irritation. Assess the area and confirm the diagnosis. Fungal rashes can mimic eczema or others. If widespread or not improving after 1 to 2 weeks, consider an oral antifungal like fluconazole. Emphasize completing the full course. Hygiene: keep areas clean and dry. Wear breathable clothing. Avoid sharing towels or clothing. For athlete's foot, wear sandals in public showers to prevent reinfection. The final letter in Papa is A for antibacterials. Topicals for minor skin infections. Mnemonic: mupirocin makes microbial messes minimal. Used for small infected cuts, scrapes, and impetigo in kids. They kill bacteria on the skin to prevent worsening infection. Examples: mupirocin, bactroban, bacitracin, and neomycin, often in triple antibiotic ointments. Apply as a thin layer of ointment or cream directly to the area. Mupirocin is great for impetigo, targets Staph aureus and Strep pyogenes by inhibiting protein synthesis. Watch for contact dermatitis, especially with neomycin. If redness or itching worsens, suspect allergy. Assess. Is it improving or spreading? Fever or expanding redness means topical isn't enough. Refer for systemic antibiotics if signs of systemic infection appear. Clean with soap and water first, then apply a thin film. Leave uncovered unless directed or use a light breathable bandage. Teach to watch for increasing redness or itching and contact the provider if these occur. Clear instructions drive safe outcomes. Retinoids for resetting skin. Red blemishes covers our acne fighters. Retinoids reset and resurface. They are vitamin A derivatives that excel at comedonal acne, blackheads and whiteheads. They accelerate cell turnover and push out clogged plugs, resetting the pore. Key topicals: tretinoin and adapalene, available as creams, gels and lotions. For severe cystic acne, oral isotretinoin is reserved when others fail. Topicals normalize follicular shedding to prevent clogging. They also improve skin texture and fine lines over time. Predictable effects: redness, dryness, peeling and increased sun sensitivity. Oral isotretinoin, severe dryness, nosebleeds, elevated liver enzymes and triglycerides, and it is a powerful teratogen. Huge safety alert. Assess for excessive irritation. For isotretinoin, verify negative pregnancy tests, monitor liver function and lipids. Teach pea-sized amount for whole face, apply at night, use moisturizer and daily sunscreen. The final piece, B for benzoyl peroxide. Remember, benzoyl peroxide burns bacteria and bleaches. It's one of the most common OTC acne treatments. Retinoids unclog pores. Benzoyl peroxide kills acne bacteria, causing red, painful pimples. It releases oxygen into the pore. P. acnes is anaerobic and can't survive oxygen. Comes as 2.5%, 10% in washes, cleansers, creams and gels. Often combine benzoyl peroxide in the morning, retinoid at night. Main side effects: dryness, peeling and redness, especially at start. Unique side effect: it bleaches fabric and even hair. Start at lower concentration, 2.5% to 5%, and assess for irritation when combined with a retinoid. Teach. Use white or old towels and pillow cases. Apply non-comedogenic moisturizer. Start every other day, then build. If significant stinging or burning, wash it off and try lower strength or less frequent use. Expect results in 4-6 weeks. Patience is key. Key nursing actions. Your RAID checklist. This guides a safe practice and prioritizes patient well-being. R. Right drug, right diagnosis. Does the medication match the condition? Antifungal versus antibacterial is a common trap. Mupirocin won't treat ringworm. Scabies, permethrin. Cold sore, antiviral. Ringworm, antifungal. Impetigo, antibacterial. E. Examine the skin. Document location, size, color and characteristics. Note lesions, rashes, wounds and signs of secondary infection. A. Ask about allergies and pregnancy. Watch for neomycin allergy. Oral isotretinoin is absolutely contraindicated in pregnancy. D. Discuss application and side effects. How much, where, how often, expected dryness or irritation, and when to call for worsening rash or systemic signs. We kept it simple and organized for fast recall. A solid mental framework is the key. Say it with me. Papa fixes red blemishes. This phrase is your anchor. Pick permethrin. A. Antivirals like acyclovir for herpes sores. P. Antifungals, the azoles for athlete's foot and ringworm. A. Antibacterials like mupirocin for impetigo. Red blemishes. Retinoids reset pores. Benzoyl peroxide kills acne bacteria. On test day. Pregnancy. Think isotretinoin danger. Itchy family, think scabies, permethrin. Early tingle, antiviral. Minor infected cut, topical antibacterial. You've got this. Thanks for studying with me. Good luck on your exam.